It's bright, it's open, it's fresh, it's new. It will feel completely different to patients and families that are obviously being cared for in older infrastructure to come here.
It really sets us apart from traditional care delivery as it relates to the setting we're creating here and the support we will be providing patients to safely get them home. And this environment will enable all kinds of supports to be provided in a way that is really effective and different than we have ever provided before.
There's so much pressure for our hospitals to do what they do best, which is provide acute medical care. And the folks that are no longer requiring acute medical care need to move as quickly as possible out of the hospital setting. This environment provides just a little more time to build their confidence, build their strength.
Just by being within the walls of acute care, sometimes patients can be medicalized. This sort of facility focuses on the opposite of all of those things. They're coming here to have a focused care plan to actually have them successfully transition to another environment.
What we're trying to do is to provide an environment that is as home-like as possible so that they are experiencing what you would do in the home environment. So if bathing, shampooing your hair, being able to get up every day and being able to go to your private bathroom, being able to get up to the dining area. Living your life while you're building your confidence to return home.
All patients and staff have the option, right? They're wearing their device that tells where patients are at all times. So that I can see as a physician that's supporting the care of a patient. When Eileen was admitted on day 1, she was only getting up about 30 minutes a day. Now she's getting up 90 minutes a day. How is she getting up? Is she moving in her room? Is she going out and interacting with the staff or interacting with other patients if that's a part of the care plan? You can actually see it and demonstrate it without the manual need.
Then the outreach team takes that, they're here in the building too, and meet the individual, their family members, and they go out into the community, may do a home visit, make some adjustments, make sure the equipment is working properly, and then we go out into the community, follow up with them, and then a soft handoff to primary care and other programs that will continue with their journey.
They simply may need a little more time, a little more endurance. They may need a little more practice with medication management, right? Things that we know if we give them a little bit more time in transitional care, they're not going to be readmitted back to hospital. As we see patients flow through West Bedford and transition to home, that will then have a positive impact back on the inpatient units flowing patients, and that impact will be felt in the walls of our emergency departments.
It's almost incredible to think it's moved as quickly as it has, but it has. The partnership we have developed with the Shanix Corporation to really take advantage and leverage the strengths of both organizations, NSH and Shanix, has been quite extraordinary. And I think that's another huge element that really speaks to why it's been moving as quickly as it's been moving and ultimately to the success of this site.
We feel so much hope. There's so much hope that we're feeling for patients to get the care that they need. And it's a great feeling, you know, especially we understand and we appreciate you reading the newspaper, you're reading all over. The pressures that we have in Nova Scotian healthcare are real everywhere. They're real nationally and internationally. So we have to think different about how we're delivering care.
This is very different, and this gets at a level of support that we have not had in this way. As Dr. Buzzy said, it's incredible to see the excitement because they know it is very different than something we've ever had in our system before.
It's good patient outcomes. They are going to feel more confident, feel that they have a team wrapped around them to continue with care, but also for when they return home. That's what's most important, is the patients.